Hi, I'm Dr. Jesse Schulz. I'm a physical therapist in Mukwonago, Wisconsin. I'll be showing you today how to treat muscle trigger points that are common areas that I find in people to be dysfunctional, to help you feel better, move better, feel stronger, feel looser, and hopefully even perform better at sports. So what is a muscle trigger point? A trigger point is basically a little band that's tender in a muscle typically that has dysfunction at the motor end plate, which essentially will cause the muscle to be weaker than it should be, and also will cause a muscle not to lengthen out like it should be. So in a nutshell, you're going to feel short and tight, which nobody wants to feel that way, but it will also make you feel weak. So this is a very common problem. A lot of people have these and they don't even realize it. Sometimes you don't even know that you have one until you start putting pressure on areas, and then you find some tenderness, and it turns out you had a trigger point that you just didn't know about. So what will you need to do treatment on yourself for trigger points? There's a lot of different options that you can use. It doesn't have to be anything expensive. First off, you can use a lacrosse ball. You could use a hard ball if you wanted. If you had one of these, you could probably make this work as well, but it would be a little bit less convenient than a hard ball or a lacrosse ball. If you're very sensitive, a tennis ball could work, and even a softball. For some areas, if you tend to have a little bit more body fat than the average person, this may be helpful for you. For whatever reason, if you don't want to use a ball for this, you could use something as like a Theracane. I don't believe this is actually a Theracane brand Theracane, but basically you could even use a true cane. The rubber stopper end of a cane actually can be used fairly well to treat a lot of these areas, or the hooked end, if it's a traditional kind of wooden variety cane, can be pretty effective for this as well. These are not the only methods to treat trigger points. TENS or electrical stimulation can effectively treat these. There is a component kind of the neural system and spinal cord that usually is involved in this as well. So if someone said I go to my chiropractor and my trigger points feel better after I go, or my physical therapist does manipulation to my spine and I feel better afterwards, I would say, yeah, that makes perfect sense to me. There's more usually than just that one area that's dysfunctional when you have a trigger point because of the interplay between the muscle and the central nervous system. But I hope this video is helpful for you. I hope you try it out and get some relief from this. And if you like it, feel free to like the video on YouTube and tell your friends. So when you're doing trigger point releases, what I would typically expect to find with an average patient who's seeking out care for something like this is that you feel maybe somewhat stronger afterwards. If it's a lower leg issue or a hip issue, maybe you feel like you're walking differently, your pain may be better as your body's going through the healing process. And if you can unhandicap these muscles, you'll find that they get stronger faster and you'll be recovering a lot quicker from whatever injury you have. Furthermore, if you are an athlete and you have been training with strength training for a while, or you've been running for a while, and you feel like you've on a muscular note have hit a plateau, sometimes if you release some of these trigger points, all of a sudden you'll get a little extra zip in your step. And if, for example, you were like me, where you were doing heel raises for a while and you're doing them on the stairs and you were stuck at 15, all of a sudden you do these trigger point releases and you're able to squeeze off 18 all of a sudden out of nowhere. So you might potentially get some of those benefits out of this, but I find it's very helpful for people that are actually rehabbing an injury to make sure that they get over it quicker. So lastly, before you do any of these things, what should you expect? If you follow my directions, what I would say is you might be doing these a couple times per day at the most at the beginning. And then you'll go from doing them several times per day to once per day to once per week to once per month to hopefully not at all. But the big thing is consistency. If we're doing this for the foot or ankle, you have to really make sure that you're wearing the right shoes. Otherwise, you're just going to overload these muscles and you're going to have more problems with it getting better. If you have a shoulder problem and you're doing these and you're doing lots of kind of goofy shoulder motions, or you're pushing your shoulders too hard, too aggressively, you'll find that, again, the trigger points come back pretty often and kind of it's going to feel like you're spinning your wheels in the mud a bit. So it's important to kind of give your body a little bit of rest, but at the same time try to be active, get yourself stronger, and you'll feel these muscles getting stronger a lot quicker. But just remember, moderate pressure at the most, hit all the tender spots that you can possibly find, and then do a massage afterwards, and that seems to increase the blood supply, flush out all the bradykinin, prostaglandins, substance P, the kind of hydrogen ions that are making the pH lower in these trigger points, the interleukin 6, 8, all those other things that are making these trigger points problematic for you. So hit the trigger points, get as many of them as you can, do a little massage afterwards, and hopefully this is something in your rearview mirror.